Hi, everyone. In this lecture, we're gonna review kidney disorders. Um, so we'll touch on a few things that you've already covered, and then we'll touch on some things that we're gonna focus on for this lecture. So I will share this lecture with you. So, kidney disorders, the pathophysiology of the renal system involves various mechanisms and processes that can lead to kidney dysfunction. The anatomy and physiology of the kidneys. This is like got a good graphic on it. The kidneys are two bean-shaped organs located in the lower back, one on each side of the spine. Each kidney is about the size of a fist. The striated kidney is the cortex, that outer layer containing renal corpuscles and tubules. The medulla, which is that inner region, organized into pyramids that contain collecting ducts, and then the pelvis, the central part where the urine collects before it flows to the ureter. And then we have nephrons. Each kidney contains about 1 million nephrons. Those are the functional units responsible for filtering blood and producing urine. And then the function of the kidneys really is filtration, reabsorption, and secretion and urine formation. So the blood enters the kidneys through the renal arteries. The nephrons filter out the waste products, excess fluids, and electrolytes from the blood. Essential substances are reabsorbed. Those things are like glucose and certain ions back into the bloodstream as the filtrate passes through the renal tubules. And then additional waste products and excess ions are secreted into the filtrate from the blood. The final product, urine, is collected in the renal pelvis and then transported to the bladder via the ureters. The kidneys really help regulate blood pressure, electrolyte balance, acid base balance, and the production of red blood cells through erythropoietin. Some common pathophysiological changes are glomerular dysfunction. That can be something like glomerulonephritis, where we have inflammation and damage of the glomeruli affecting filtration. We can have tubular dysfunction. This can result from ischemia or nephrotoxins, leading to impaired reabsorption and secretion functions. And then we have interstitial disease, uh, where we have inflammation in renal interstitium affecting kidney function. The first kidney issue that we're going to talk about is chronic kidney disease. Chronic means that it's something that you live with and it's progressive, irreversible loss of kidney function. Over time, due to diabetes, hypertension, or glomerulonephritis. The pathophysiology of CKD, we will lose nephrons and we will increase fibrosis. So I have a nice little graphic here that will help you understand that. Then we talk about acute kidney injuries. Again, acute. So it's a sudden decline in kidney function, often reversible, and it can be categorized into pre-renal, intrinsic, and post-renal. It's really wherever the problem is. Is it before the kidneys, in the kidneys, or is it after the kidneys in those ureters? So again, another little infographic to help you. Kidneys also deal with fluid and electrolyte imbalance. Impaired kidney function can lead to retention of sodium, potassium, and water, causing hypertension, edema, and electrolyte disturbances like hyperkalemia. And then we have acid-base disorders. We talked a little bit about this when we did the acid-base lecture. So the kidneys play a crucial role in maintaining acid-base balance. Dysfunction can lead to metabolic acidosis, characterized by the accumulation of acids and inability to excrete hydrogen ions. And here again, another cute little infographic. The kidneys also play a role in hormonal regulation. So the kidneys produce hormones like erythropoietin, regulating blood cell production, and renin, involved in blood pressure regulation. Dysfunction can lead to anemia and hypertension. And then also, we talked about how the kidneys play a role in systemic effects. So here you can see all the things that the kidneys do with the systemic effects. So now, how do nurses assess the renal system? A system nursing assessment is a comprehensive nursing assessment for the renal system, and it involves multiple components that help evaluate kidney function and identify potential issues. So we want to start with our health history. We want to get a chief complaint, document any symptoms such as changes in urination, frequency, color, volume, pain, or swelling. We want to review past medical history. Are there any conditions like diabetes, hypertension, UTIs, kidney stones, previous kidney disease? Are the patients taking any medications? So, nephrotoxic medications include NSAIDs and certain antibiotics, and any medications affecting blood pressure or fluid balance will also impact the kidneys. And then we want to get some family history. Are there any familial kidney diseases or conditions that could affect renal health? Then we'll move to our physical assessment, where we monitor blood pressure, heart rate, and temperature because we know hypertension can indicate renal issues. Uh, the general appearance. So we want to look for signs of fluid overload, maybe edema, weight gain, or dehydration, dry mucous membranes. Then we'll do an abdominal assessment. We want to palpate for any kidney tenderness and assess for any masses or organomegaly. Then we want to do a urinary assessment. So we want to assess urine output. Normal urine output is about 30 mils per hour. We want to evaluate the urine characteristics. What does the color look like? What is the clarity? What is the odor? And then check for signs of hematuria or proteinuria. Then we'll look at some lab tests. We're going to get a creat level. Elevated levels indicate impaired renal function. We'll get a BUN, provides information on kidney function and hydration status. And then we'll monitor electrolytes such as sodium, potassium, calcium, and phosphate. Then we'll get that urinalysis like we've talked about and assess for protein, glucose, ketones, blood, specific gravity. And then we'll do a microscopic evaluation to reveal cells, crystals, or casts. Then for imaging, we can do an ultrasound or CT scan to assess kidney size, structure, and any obstruction. And then we might do a 24-hour urine collection, which will evaluate the kidney function and help assess proteinuria and creatinine clearance. Then we'll do something called a functional assessment. We'll check for fluid balance, so we're monitoring the input and output and any intravenous fluids. Then we'll do a dietary assessment. What are the dietary habits, and particularly protein, sodium, and potassium intake? We want to educate the patient about the importance of hydration, dietary modifications, and recognizing signs of renal dysfunction. And then we want to regularly document findings and any changes in the patient's condition and monitor trends and lab results. So, the first one we're going to talk about is acute kidney injury. An acute kidney injury is a rapid decline in kidney function characterized by an increase in serum creatinine and or a decrease in urinary output. It occurs over hours to days and can be reversible if identified and treated early. So, acute kidney injury, you might want to write this down, is something that's going to occur hours to days. So, with our causes, we have this pre-renal, intrinsic, and post-renal. Um, Pre-renal can be caused by factors that reduce blood flow to the kidneys. So, hypovolemia due to dehydration, hemorrhage, heart failure, sepsis, or renal artery stenosis. Then we have the intrinsic or the intrarenal. This is going to be direct damage to the kidney tissue. So, acute tubular necrosis, glomerular nephritis, acute interstitial nephritis, or nephrotoxic agents like certain medications, and contrast dye. So, before you send your patient for contrast, you should know how their renals are. Then we have post-renal, which is caused by obstruction of urine flow, kidney stones, tumors, or enlarged prostate leading to urinary retention. So sorry about that. Um I probably just jumped away for a minute. So again, the acute kidney injury pathophysiology, we have that pre-renal, that decreased blood flow. The damage to renal tubulars is going to be that intrinsic, and then our post-renal. Acute kidney injury signs and symptoms. We have decreased urinary output, fluid retention, elevated BUN and serum creatinine, electrolyte imbalances, fatigue, nausea, and confusion, and possible flank pain in post-renal causes. And here you have like a little infographic that might help you study. So medical advantage for AKI is identify and treat the underlying cause. So depending on where you are injuring the kidney, if it's pre-renal, post-renal, intrarenal, we need to address that, whatever's happening. So, like if we are dehydrated or we are hypovolemic or we have sepsis, we got to fix those things. So, address dehydration, discontinue nephrotoxic medications, and relieve obstructions. And then for our fluid management, we want to do careful administration of fluids, may require diuretics for fluid overload. Electrolyte management, we want to monitor and correct imbalances, especially potassium. And then dialysis may be necessary in severe cases or if complications arise. So here we have the nursing implications. We have assessment, patient education, collaborative, and supportive care. And I'll let you read that. So now we're going to talk about chronic kidney disease. Chronic kidney disease is a progressive loss of kidney function over months to years. AKI was days to weeks. CKD is months to years. And it's characterized by a decrease in GFR and lasting damage to the kidneys. Causes are going to be diabetes, hypertension, glomerular nephritis, polycystic kidney disease, and prolonged obstruction. So, chronic kidney disease is a progressive loss of kidney function over time, typically lasting 3 months or longer. The kidneys contain 1 million nephrons, which are the functional units that filter blood. In CKD, these nephrons gradually become damaged and die due to various causes. Remaining healthy neurons try to compensate for the loss by increasing their workload, a process known as hyperfiltration. Initially, this may maintain kidney function, but over time, the increased workload can lead to further damage. Damage to nephrons leads to scarring, known as fibrosis, and inflammation, further reducing kidney function. Waste products, electrolytes, and fluids accumulate in the body, leading to various complications. As kidney function declines, the body struggles to maintain balance, resulting in fluid retention and electrolyte imbalances and ultimately acidosis. Systemic effects for CKD include anemia, bone disease, and cardiovascular disease. And here we have CKD signs and symptoms, and this will tell you all sorts of there's a nice infographic here. CKD medical management control. We want to control the underlying conditions. So we need to manage the diabetes and hypertension aggressively. We want to make dietary modifications, low protein, low sodium, and possibly low potassium diets. We want to use antihypertensives. We want to use phosphate binders and erythropoiesis stimulating agents for anemia. Dialysis or transplantation is required in advanced stages, stage 5. And the nursing implications here are we're going to regularly assess vital signs, weight, and laboratory values. And here we have, again, another infographic for you. Now we're going to move to end-stage renal disease. End-stage renal disease is the final stage of chronic kidney disease characterized by a significant and irreversible decline in kidney function, typically defined as the GFR level less than 15. At this stage, the kidneys can no longer maintain the body's balance of fluids, electrolytes, and waste products, necessitating dialysis or kidney transplantation for survival. End-stage renal disease is the final stage of chronic kidney disease where the kidneys can no longer effectively filter waste products from the blood, typically defined as having a GFR of less than 15. In ESRD, a significant number of nephrons are damaged and lost, often due to prolonged conditions like diabetes, hypertension, and glomerulonephritis. As nephron numbers decrease, the kidney's ability to filter blood and excrete waste diminishes dramatically. Waste products accumulate in the bloodstream, leading to a condition known as uremia. The kidneys lose their ability to regulate fluid, leading to fluid overload and swelling. And then electrolyte imbalances occur, such as hyperkalemia and hyperphosphatemia. The inability to excrete hydrogen ions leads to metabolic acidosis, causing a decrease in blood pH. Anemia develops due to decreased erythropoietin production, affecting red blood cell formation. Patients may experience cardiovascular issues due to fluid overload, hypertension, and electrolyte imbalances. And other complications include bone disease from imbalances of calcium and phosphate. Um, Here we have some causes. So we talked about diabetes, hypertension, glomerular nephritis, polycystic kidney disease, and prolonged obstruction. And here we have again another little infographic for you. So some of the causes. These that actually should say symptoms. Sorry, I'll fix that. Medical management here is going to be dialysis. We can do hemodialysis or peritoneal dialysis or even kidney transplantation. The medications are going to be antihypertensives, phosphate binders, erythropoiesis stimulating agents, and vitamin D supplements. Our nursing implications, we're going to monitor vital signs, fluid status, lab values. We're going to teach about dialysis options, dietary restrictions, and medication adherence, and provide emotional support, and then coordinate care. And here is a little bit of a nursing care plan for patients with end-stage renal disease. Now we're going to move into the types of dialysis. So we have peritoneal dialysis. This is a dialysis method that uses the peritoneum, the lining of the abdominal cavity, as a natural filter to remove waste products and excess fluid from the blood. When you get this PowerPoint, watch these videos. There's lots of videos, but they're super short. So I'm not going to play them on here because I've been told that you don't actually get to hear what they are. So there's a 2-minute video on peritoneal dialysis. Peritoneal dialysis indications are going to be CKD, ESRD, patient preference. So again, with the ESRD, we know that we have two options. They might choose peritoneal dialysis, and then hemodynamic instability, patients who cannot tolerate hemodialysis. There are two types. There is continuous ambulatory peritoneal dialysis, where we have manual exchanges throughout the day, and automated peritoneal dialysis, where we use a machine to perform exchanges during the night. The mechanism of action for peritoneal dialysis is we're going to use a diacylate infusion, so a sterile solution introduced in the peritoneal cavity. Waste products and excess electrolytes move from blood vessels to the peritoneum into the diacylate, and the used diacylate is drained, carrying waste away. The advantages for peritoneal dialysis is that it's a home-based treatment. Patients can perform it at home. It can be done during the day or the night, and it may allow for some kidney function to remain. Some disadvantages are peritonitis is a significant complication. The catheter may malfunction or leak, and the potential for glucose reabsorption leading to weight gain and diabetes. Our nursing implications for peritoneal dialysis is going to be the technique for performing exchanges, because we have to teach our patients how to do this. Signs and symptoms of infection and dietary restrictions. Our assessment is we're going to monitor their vital signs, weight and fluid status, inspect the catheter site for signs of infection, and assess for abdominal tenderness or distension, and then address emotional and mental health needs, assist with lifestyle adjustments and adaptations. It's very important to teach your patients that whatever is going into the cavity absolutely has to come out of the cavity, or you're going to have this abdominal distension. Peritoneal dialysis complications are going to be peritonitis, exit site infection, catheter related issues, and fluid and electrolyte imbalances. Our follow-up care is going to be regular monitoring of kidney function, electrolytes, and overall health, and routine follow-ups with healthcare providers to adjust the treatment plan as necessary. On your um, on your on your version, this is a video. So again, watch this video. It's just a patient, and it's a 2-minute video of what he goes through with peritoneal dialysis. So now we're going to move to hemodialysis, a medical procedure that uses a machine called a dialyzer to filter waste, excess fluid, and toxins from the blood when the kidneys can no longer perform this function. Here's another video on hemodialysis. Indications are going to be the same: chronic kidney disease and stage renal disease, except for we can use hemodialysis for acute kidney injury. And then we can also use it for severe electrolyte imbalance. Those two are emergent cause indications, and we can absolutely use it for that in the hospital setting. We have two types. We have an in-center hemodialysis and a home hemodialysis. So the in-center is going to be performed in a dialysis center, typically 3 times a week. And the home dialysis, patients can perform this at home, either manual or with a machine. And this is just a little infographic on what's happening. Um, Hemodialysis mechanism of action. So we have the blood access is accessed through an AV fistula, an AV graft, or central venous catheter, and blood is drawn from the body, filtered through the I'm messing up my words, okay, the artificial kidney, and returned to the body. We're going to use diffusion and ultrafiltration. So waste products move from the blood to the diacylate, and excess fluid is removed. Advantages here are going to be effective waste removal, control of electrolytes, and immediate treatment. Disadvantages are going to be that it's super time consuming. Sessions typically last 3 to 5 hours, 3 times a week. There's vascular access issues, so risk for thrombosis, infection, or stenosis, and then potential complications of hypotension, cramps, fatigue during or after treatment. So our nursing implications here are going to be explanation of the procedure, importance of adherence to treatment schedules, monitor vital signs before, during, and after, assess fluid status, check access site for signs of infection complication, address emotional and physiological needs related to chronic illness, and provide resources or support. And I have this little checklist here so that it'll help you remember a little bit. Complications are going to be hypotension, muscle cramps, infections, and anemia. And follow-up care, again, there's a video here about hemodialysis, so watch that. Regular monitoring of kidney function, electrolytes, and hemoglobin levels, routine follow-ups, and nephrologists, and dietitians for dietary and fluid management. Man, I am struggling with words. I think that's Oh, no, there's more to this. I'm sorry. Let me share again. I thought I was done. There are like 20 more slides. So now we're going to talk about renal transplant, surgical procedure that involves placing a healthy kidney from a donor into a person with end-stage renal disease to restore kidney function. This is a video about renal transplant. The indications are going to be in end-stage renal disease, chronic kidney disease with rapid progression, acute kidney injury with permanent loss of function, and quality of life improvement. Patients requiring dialysis seeking a better quality of life. There are 2 types of donors for renal transplant. There's a living donor, a healthy individual donates one of their kidneys, and a deceased donor, a kidney is obtained from a donor who has suffered brain death. In class, I will tell you a story about that. Renal transplant assessment and evaluation. We're going to do a transplant evaluation where we get a medical history, physical exam, and lab tests, assessment of kidney function, cardiovascular health, and overall fitness. And then compatibility testing is super key, blood type matching, and HLA typing to reduce the risk of rejection. The procedure is we place the kidney. The new kidney is usually placed in the lower abdomen, and blood vessels and ureter of the donor kidney are connected to the recipient's blood vessels and bladder. Post-transplant care, we're going to give immunosuppressive therapy to prevent organ rejection. Common medications are going to be corticosteroids, calcineurin inhibitors, and antimetabolates. We're going to monitor for rejection, so regular lab tests to assess kidney function and detect early signs of rejection, and infection prevention. Renal transplant advantages, we're going to have an improved quality of life, better survival rate, and restoration of kidney function. Disadvantages are going to be rejection, side effects of immunosuppressants, and surgical risks. Renal transplant nursing implications are going to be you could either have to perform post-op care for the live donor or recipient. So that's why I included it on there. But patient education is going to be the importance of medication adherence and follow-up appointments, signs and symptoms of rejection and infection to monitor, regular monitoring of vital signs, kidney function, and electrolytes, assess surgical site for signs of infection and complications, and supportive care. Renal transplant follow-up care is going to be regular checkups, lab tests, and long-term health management. And now we're going to move to nephrectomy, which is a surgical procedure to remove all or part of the kidney. Nephrectomy indications are going to be kidney tumors, severe kidney damage, kidney stones, polycystic kidney disease, living kidney donation. Types of nephrectomy, and here's a little video where they compare total to partial. Total nephrectomy is a complete removal of the kidney, and partial is the removal of only a portion of the kidney. And then there's radical nephrectomy, where the removal of the kidney along with surrounding tissues, adrenal gland, and lymph nodes. That's commonly going to be for cancer. The nephrectomy surgical approach, and I have 2 incisions here that you would have to monitor as a nurse based on the approach they choose. So we have open surgery, traditional method involving a larger incision in the abdomen or flank, and then laparoscopic surgery where there's minimally invasive approach using small incisions and a camera, often resulting in a quicker recovery. Your nephrectomy pre-op assessment is going to be that medical history, imaging studies, and blood test. And then your post-op care is going to be monitoring vital signs, fluid balance, urinary output, pain management, and infection prevention. There might be some ostomies that you might have to manage, so that's why I have here. Nephrectomy complications, you're going to have surgical risks or renal insufficiency and blood clots. Your nursing implications in here, it just shows you what a radical nephrectomy is and then what a partial nephrectomy is. So information on the procedure, recovery and lifestyle changes, signs of complications to watch for. You want to assess vital signs and surgical site and kidney function and fluid status, and then provide that supportive care. Your follow-up is going to be regular checkups, long-term monitoring, and lifestyle modifications. And here on the last slide is a story of Bobby Labonte, who is a famous NASCAR driver, and he had a nephrectomy. So it's just a quick little story about him. All right. So that is that. I'm going to stop sharing. So that's what we're going to cover this week in class, and you'll have a video of the week shortly. So I'm going to stop recording and see you all there.